Hi guys, apologies for starting so late. So today's session we were just looking at going back to school and what this looks like in Tower Hamlets and how to kind of make sure that we go back to school and ensure that children are kept safe during this time. So one of the things that I wanted to start conversation around was kind of the importance of going back to school. And I guess the key point around this is that children have a right to an education, and the best place to have that education, to get that education, is at school. And schools have done a lot of things in this period of time to kind of make sure that children are as safe as possible within school and to minimize the risk whilst they're at school. Some of those things will include staggered start times for children. So all children will be returning to school at the beginning of September, but they may not be returning to school all starting at the same time. So, for example, if schools previously started at 9 o'clock, some children may be asked to arrive at 9, whilst another group of children are asked to arrive at 9:15, and so on and so forth. Within schools as well, many schools have put out one-way systems, so children are walking in one direction. So again, to limit the flow of people in any one place, going, both in both directions. In addition to this, sort of regular hand washing is being built into the normal and everyday part of school lives. Um, and then on top of which, schools are really doing a lot around cleaning. So just hiking up how much cleaning they do during the day and at the end of the school day. And these measures have been put in place to really just limit transmission while children are at school. And I think one of the really, really important things to remember is that transmission between children is actually really low. And there's a lot of evidence which suggests this already, which is kind of what supports the idea that children should be going back to school in September. Um, the other thing to really note is, apart from going back to school and the educational benefits of going back to school, one very important thing to note is that actually going back to school really encourages children to be active again, and because there's a lot of play built into the normal school day. In addition to this, there's when you think about it, there's loads of sort of mental well-being benefits to children being back at school because they get to see their friends again. They just get to kind of get that normality back into their normal everyday lives, which is also very, very important for children. Um, and then I guess some of the other things that will be asking children to or families to consider is how they get to school. So where possible, the guidance talks about avoiding public transport. And what we as public health want to do is really encourage families to think about active ways in which they can go to school. So can your child scoot to school? Can your child walk to school? Even skip to school, run to school, and just find basically really fun ways of getting to school, which kind of avoids and limits going to school via public transport. Um, I am just going to have a quick look into the chat. So excuse me while I look down, just to kind of see if there's any questions that you might have at this time. Please leave any questions. Not just yet. I can't see any questions coming through. But again, this is really just an opportunity for parents, for carers, to kind of just drop your questions. What questions is it that you have around the school day and how a school is being, how a school will try to ensure that your child is safe? And one of the things to really, really key to things to remember is that every school will be operating slightly differently. They'll be looking at the guidance, the government guidance, also looking at guidance that we as public health can provide, and essentially putting the two together and working out for their school environment what's the best way for them to operate. One of the questions that we previously had, I believe in a previous discussion, was around what happens if your child develops symptoms within the school day. So if your child develops symptoms within the school day, the first point of call will be to contact you as a parent is what the schools will be doing. So they'll be contacting you as a parent to collect your child. And in the interim period from when, sort of the onset of the symptoms and when you're able to collect the child, your child will be separated from the other children within the class. Again, just to kind of make sure that we keep all the children within the school environment safe, and they will kind of wait for you to pick them up. And then what schools will be encouraging you to do, and what we as public health will be encouraging you to do, is to get a test as soon as possible. And then once you have that test, depending on what that result is, so whether it be positive or negative, you still need to self-isolate. So your child will need to self-isolate for 10 days, and then the entire family will need to self-isolate from 14 days. And that's 14 days in which your child has symptoms. So that's really, really important. And more than anything, we really want to encourage children and family members, the entire family, to self-isolate. It's really, really important in limiting the spread of coronavirus within the borough. Apologies again. I'm going to keep looking down every so often as I look for questions in the group. So as I have said before, but I noticed that a few more people have joined us. If you have any questions around what's being done to keep your children safe when they return to school, or to at least limit the spread of coronavirus, please feel free to use the chat function within this live chat to ask any questions that you might have, because this is really just an opportunity for me to explain to you what or translate at least some of the guidance that's already available, and then to also talk through with you what schools are doing to limit the spread of coronavirus within schools. But again, recognizing that each school will be doing slightly different things and taking on the guidance slightly differently. Okay, whilst I wait for a few more questions to come through, again, I'll start. I didn't start by introducing myself, but I will introduce myself now. So my name is Abimbola Lucas, and I work in the public health team of Tower Hamlets. And my role as program manager for the adolescence age group essentially means that I look after the health and well-being, or think and consider the health and well-being of young people in Tower Hamlets. So part of that role would be, outside of COVID, would to look at how we support young people around their sexual health, their mental health, and any substance misuse issues that they might have. Apologies for the silence, but once again, if you do have any questions, please feel free to drop them in the chat function below.